In today's episode of Sperm Can Find a Way, crazy ways that people have gotten pregnant, a story about a pregnancy 4 years after a hysterectomy. Now, there are about 100 case reports about pregnancies that happen after a hysterectomy. Half of them were pregnancies that occurred right after the hysterectomy, and the other half are what they call late onset pregnancies. In my Sperm Can Find a Way playlist, you can find the story about a woman who had sex the day before her hysterectomy and then had a baby 9 months later. For those pregnancies that occur months to years after the hysterectomy, almost all of them result in a non-viable ectopic pregnancy. So pregnancy obviously not in a uterus, but also not viable, typically discovered between 12 to 14 weeks. So this case is particularly notable because it resulted in the live birth of an infant. This patient had had a supracervical hysterectomy for abnormal bleeding. Supracervical means that they leave the cervix in place but take the uterus. 4 years after her hysterectomy, she started having this crampy abdominal pain and presented to the hospital. On exam, they found that her cervix was 4 to 5 centimeters dilated, and they saw a fetal head. Again, this was 1942, so they didn't have the equipment that we had, and they assumed that the baby was no longer alive. 8 hours later, despite not having any contractions, she dilated to about 8 centimeters and then delivered a viable female infant. Unfortunately, because it was the 1940s, this baby was quite small, about 900 grams, and ended up not making it past the 35-hour mark. The patient herself had some complications because she had to undergo an exploratory laparotomy because she was having extra bleeding. And when they looked in her abdomen, they found that gestational sac in the place where her uterus would normally be attached to the cervix. After her surgery, she required several blood transfusions, but she ended up going home several days later. And this is why anyone who presents to the ER with abdominal pain gets a pregnancy test.